Hi everyone, we are in the last part of the lymphatic system. We will discuss some disorders in immunity. So remember last time when we talked about immune system, the lymphatic system, the first lines of defense, second lines of defense, the third line of defense. For normal peoples, they're able to perform all these type of defense mechanisms. But there are some people that have disorders on their immune system. We can divide these disorders into two types. The first one is the one that what we call have underreactions. So this is the first type of disorder. So their immune system is actually underreaction. It means that maybe part of their immune system, like the T cells, okay, so the T cells unable to perform surveillance. So this T cell, usually they survey our body. Remember, there are 70 to 80% of T cells circulating in the blood. So this T cell actually survey our body. If there is a cells that divided uncontrollably, like tumor or cancer cell, then the T cell will attack that cancer cell, will attack that tumor cell. It prevents us from having the cancer or tumor. So for people that have these underreactions, like lack of surveillance, usually they will get cancer or tumor. The second type of underreaction, so this lack of surveillance is considered as the first type of underreaction. The second type of underreactions, there are some people that do not have immunity. So they lost their immunity. Maybe they lost all of them, the T cells, the B cells, so they actually do not have the T cell and B cell, or maybe just part of their immune system. They might not be able to create the T cells only or B cell only. So this is what we call the loss of immunity. Sometimes it is known also as a immunodeficiency disease. So immunodeficiency disease, this is the second type of underreaction. Now, there are also some people that overreactive. So their immune system is really overreactive. So this is what we call the overreaction. And usually these overreactions of immunity is called as hypersensitivities. So their immune system is really hypersensitive, super sensitive. If it is caused by the hypersensitivity of antibodies, okay, which is produced by the B cells, then it can be divided into three types. Okay, type 1, hypersensitivity type 1, it is caused by the IgG. So this is IgE. So the IgE is hypersensitive. And usually this will cause this person to have allergic reaction. So people that have allergy, it is because their IgG is very, very reactive, okay, over the normal conditions. The second type is called the type 2 hypersensitivity. And this is mostly caused by the IgM. Remember, there are 5 types of Ig, IgG, IgA, IgM, IgD, and IgE. Okay, so for the type 2, the one that is really hyper-reactive is the IgM. An example is blood transfusions. The one that is not matched in compatibility in blood transfusion it will cause this type 2 hypersensitivity. Also, married between RH negative women with positive RH positive men can also causing this type 2 hypersensitivity. And then type 3 hypersensitivity. This is caused by IgG. So this is IgG that is really hypersensitive, super active. And this IgG sometimes attacking our own tissue. So these ones will cause, for example, autoimmune disease. So autoimmune disease mostly due to the overreaction of IgG. And then the last one is called the type 4 hypersensitivity. This is the only one that is caused by the T cell, okay? Mostly the TC. Like for examples is tissue graft rejections. This is usually caused by the TC that reject the tissue from other people, from the donor. Okay, so these are the 4 types of hypersensitivity. Again, there are 2 types of disorders in immunity: underreaction and overreactions. We're gonna discuss one by one. For the underreactions, again, there are 2 types. Okay, lack of surveillance, and it is because the T cell is not surveying our body. Therefore, some cell that divide uncontrollably will be growing very fast. So overgrowth of abnormal tissue, and this is cancer. So the lack of surveillance can cause that person to have cancer or a tumor. The second one of underreaction is called loss of immunity, and this one will cause disease called the immunodeficiency disease. So this disease is due to the deficiency of immune system. Sometimes they just lost of their immune system. Remember, there are 2 main types of immune system or immunity, which is done by B cell and T cell. This is the 2 types of immune response. The T cell, do what we call the CMI, cell-mediated immunity, and the B cell produce antibody, and the response is called the AMI, antibody-mediated immunity. So this, if, for example, that person do not have the B cell and T cell, then they will have deficiency on their immune system. There are 2 types for this immunodeficiency disease. The first one is called the primary immunodeficiency. So this is congenital. It means that it is made or caused by some problems on their gene, some mutations. So this is congenital. This is happenings in the embryo. So during embryo times, this baby, they unable to create their immune system. So this is what we call the primary immunodeficiency. So they will born with this type of disease. The second one is called the secondary immunodeficiency disease. So usually this person was born normally, but during their life, they may be exposed by something that causing their immune system to be lost. The famous example is when that person have the HIV infection. This HIV will destroy the T helper, which is part of the immune system. And when they lost their T helper, then they will not be able to protect themselves against other disease. So this is immunodeficiency. They lost their ability to defend themselves, and it is happening after they born. Therefore, it's called a secondary immunodeficiency disease. Okay, the primary immunodeficiency disease, which is lack of B cell and or T cell activity. So if it is B cell defects, it's called the A-gamma globulinemia, and because a B cell producing the antibodies, then this person will not have the antibodies produced. Okay, and these persons usually, if they loss of B cell, they usually have sensitivity, is very sensitive against the bacterial infection. So it's really easy to get bacterial infection because they don't have the antibodies that protect them against bacteria. So mostly antibodies fight against bacteria. If it is T cell defect, so these persons do not produce T cells or the T cell abnormal, and then usually this person will have easy to get virus or viral infection, because T cell usually fights against viruses. So this is some people that have this primary immunodeficiency. So this baby born with this condition. If, okay, this is very severe, if both of these B cell and T cell are not available or lost, that disease is called the severe combined immunodeficiency, or SCID. So this baby is actually born without any protection. So they can have disease, infectious disease easily, any type of infectious disease. And usually this baby will not stay long. So they will usually die several days, weeks, or several months after they born, because they're unable to protect against any disease, even the disease that is really, really weak disease. It can cause problem to them. Okay, so this is severe combined immunodeficiency. Okay, the second one is secondary immunodeficiency disease. This immunodeficiency acquired after they born. So it may be caused by infection, like HIV infection, some other organic disease, maybe chemotherapy, or maybe radiation that removes some part of their immune system. The most common one is AIDS. So AIDS is a disease, immunodeficiency disease, that is caused by HIV infection. And these HIV viruses destroy the T helper cell. And remember, I mentioned about the function of the T helper, which is activate the TC and also B cell. So if this person do not have the T helper, or the T helper is really low in number, then they will get disease called the AIDS. So AIDS is actually disease caused by the T helper destructions by the HIV. Look at this diagram over here. Okay, so during the initial infections, HIV enter into the system. It's gonna be increased, and then it will be decreased because what? Because our body produce the antibodies that destroy some of the HIV. However, this HIV is actually will not 100% remove, because these HIV viruses, they actually stay in our DNA. So someone that HIV positive will stay HIV positive for their lifetime, because this virus stay in their nucleus, become part of their DNA. It will produce the HIV viruses on that cell. And then the one that is attacked is actually the T helper cell. Okay, so T helper cell will carry these HIV viruses on their nucleus, on their DNA. Okay, so yes, the HIV virus will be lower, but they still stay positive. But at the same time, these HIV viruses will kill the T helper little by little until, so this line is for the T helper cell, until it's reached very low, about 200, less than 200 cell per microliter. Then the HIV virus will increase again, okay, when the T helper is really low. And this is the time when, okay, this is the limit when that person's become AIDS. And during this time, then mostly they will be helpless because they don't have the ability to protect themselves against disease, any infectious disease. If you see this, the incubation period between from the initial infections to become AIDS, it takes a long time. So usually about 2 until 15 years, the incubation time. It means that this person that carry HIV positive sometimes do not realize that they have the HIV positive for that long time. Okay? And then they can spread that disease to other people until they reach their T helper is lower than 200 cell per microliter. Then they start to have this AIDS. Okay, so some medicine that used for HIV people, they usually just make these incubation times longer. So they don't really remove the medicine, unable to remove the HIV viruses from their body because it will stay inside their DNA. So this just strengthen, make the incubation time longer, okay, until we don't know until time. As long as they use the medicines, then they will not reach the AIDS limits. Okay, so they will not they not become AIDS people as long as they receive the medicine. But if they stop the medicines, then as soon as possible they might reach the AIDS symptom. Okay, so this is the secondary immunodeficiency. Now we go to the second type of disorder, which is the overreaction. Okay, so our immune system is really overreactive to antigen that is not a problem to us. It will not cause disease to us, but still our immune system try to remove them, try to attack them. So this is overreactive. So usually it's happening to some people that have this kind of abnormality disorder. And these overreactions mostly is called as hypersensitivity reaction. So their immune system is really hypersensitive against something that is not harmful in our body. So this is exaggerated immune response to non-harmful antigen. So antigen, the one that enter our body is not really harmful. Like for example, pollen. Pollen is not harmful. This is not a disease, but still our immune system try to attack this pollen and causing that person to have the allergy. Blood transfusion, for example. Okay, so blood that enter into our body from donor usually is not harmful, but still our body try to remove them, try to attack them. Okay, so this is hypersensitivity. Some can affect almost anyone, but some can affect only people with inherited ability to have this hypersensitivity. So some people may be normals against pollen, but some people is become allergy to that pollen, and sometimes this is caused by the inheritance. Okay, there are 4 types of hypersensitivity. You're gonna see this table. The first one, of course, is called the type 1 hypersensitivity. It is also known as immediate hypersensitivity. And the example is allergy. So allergy is a type of type 1 hypersensitivity. And again, this is caused by the IgE. So IgE, one of the least abundant type of antibody, is actually become very, very reactive against some antigen that is harmless, is not harmful. Okay, so like pollens, bee sting, for example. So this is causing that people to be allergic, or maybe just mosquito bite. It can also cause these people to have the allergic reaction. So this is caused by the IgE that is overreactive. The second one is called the type 2 hypersensitivity, and this is mostly caused by the IgM, that is overreactive against some antigen that is actually harmless. Example is when type A blood person receive the donor from type B, for example. So this blood that's coming from donor is actually carry the antigen that is harmless to our body. But the antibodies try to destroy that antigen. It's causing problem to the recipient. Okay, so that's the type 2 hypersensitivity that is caused by the IgM that is really hyperreactive. The next one is type 3 hypersensitivity. It is also known as immune complex mediated sensitivity. And this mainly caused by the IgG. And remember, IgG is the most abundant type of antibody. And this IgG will make or will attack, so most of the time, is our own antigen. So self-antigen will be attacked by this IgG, and it will cause that person to have autoimmune disease. Like, for example, systemic lupus erythematosus, RA, rheumatoid arthritis, type 1 diabetes, okay, rheumatic fever. This is all the type of disease, autoimmune disease, that is caused by IgG that is really, really hypersensitive. Okay, for normal people, this IgG will not attack that organ. But for people with this type 3 hypersensitivity, their IgG will attack the antigen or the organ that is actually our own organs, our own antigens. So these are the 3 types of hypersensitivity that is caused by the antibodies that is really reactive. Okay, IgE, IgM, and IgG. Now the type 4 hypersensitivity, this is the only one that is caused by the T cell. Okay? The T cell. So the T cell is actually really overreactive against something that is not harmful. Okay? Like, for example, when someone receives the organ transplantations, like skin transplantation, for example, then the T cell will try to reject that cell or that tissue. So that organ is actually not harmful to us, okay, to the recipient, but still the T cell try to reject that organ. So it's causing problem to that person. Okay, so that's the type 4 hypersensitivity. Okay, so again, let's see this type of hypersensitivity, type 1. The most common one is allergy. And again, this is due to the IgE overreaction. Type 2 hypersensitivity, this is antibody-dependent cytotoxic reaction and mostly mediated by the IgM that is really reactive. Example is blood transfusions or positive and negative blood incompatibility. Type 3, this is caused by the IgG. So IgG is overreactive. Sometimes it even attacks our own antigen, our own organs. Example is type 1 diabetes, rheumatoid arthritis. And then type 4, and this is the only one that is caused by T cell, which is the TC is overreactive to remove or to attack against cell or organs that is not really harmful to our body. Okay, this is the tables of these 4 different type of hypersensitivity. So type 1, this is immediate reaction. Example is high fever, allergy, pollen allergy. Any type of allergy is included in this type 1 hypersensitivity. Again, this is caused by the IgE that is overreactive. Type 2 hypersensitivity. This is mostly caused by the IgM. Example is mismatch in blood transfusion. Type 3 hypersensitivity. This is caused by the IgG. And sometimes this IgG will attack our own cell, our own antigen, and causing the disease called the autoimmune disease or autoimmunity. Type 4, this is the only one that is caused by the T cell. And this is causing the T cell to reject maybe rejection on tissue transplantation or organ transplantation. And also in dermatitis, like for example, poison ivy, this is also caused by the T cells. Look at this type 1 hypersensitivity, how this type 1 hypersensitivity reactions in our body. So there are 2 steps in this type 1 hypersensitivity or allergic reaction. So the first encounter with allergens, maybe pollen, for example, it will be attacked by a B cell. So B cell produce the antibody. It will produce the antibodies after the encounter with the pollen. And then these antibodies will attach to our mast cell. Okay, so this is the first step. So this is the first step. This is called the sensitizing dose. And usually it's happenings maybe several days, several weeks, even sometimes several months for some people. So they usually don't realize there is no allergic reaction yet in step 1. And then it will develop into step 2, which is producing allergic reactions. So when that person receives the second dose of pollen, these pollens will be attacked directly by the mast cell. And the mast cell will produce the allergic mediators like histamine, bradykinins. It will be released by this mast cell. And these allergic mediators then will make our body to produce something like, for example, produce more liquids from the nose, from the eyes, so itchy eyes, runny nose, and etc., or headache. So this step 2 is for some people happenings maybe after 2 days of the first pollen encounter, or 3 days, 4 days, maybe weeks after that. So sometimes people that They think that they don't have the allergy, but after several months, they live in some area that have pollen that causing allergy. They become they're having that allergy reaction. But for some people, they never have these allergic reactions. Okay, now what are these allergy mediators do? So there are several allergy mediators that is produced from the mast cell. The most potent one is the histamine. So this is the most potent type of allergy reaction. It is the reason why when we get the medicine for allergy, they mostly have the antihistamine on their medicine. It's used for blocking the histamine release from the mast cell. So this histamine is the most potent type of allergy mediators. In addition to histamine, there are also serotonin, bradykinin, and these three mediators can cause enlargement of blood vessels on the skin. So the skin reactions may be itchy, become redness because of more blood actually going to that area. It will constrict the smooth muscle on the respiratory tract, so that person will have difficult to breathe because of these allergy mediators, the histamine, serotonin, bradykinin. And when it is going to the secretion cells, like lacrimal glands in the eyes, it actually dilate that production or dilate the blood vessel that go to this area and causing the eyes to produce more tear. And also this tear will go to the nose, causing that people to have runny nose. So this is some action of histamine, serotonin, and bradykinin. There is another allergy mediator, is called the prostaglandin. This is the one that actually go to the brain, to the sensory system, and causing the headache. So the headache is caused by mostly by the prostaglandin produced by this mast cell. Leukotriene, this is especially for people that have asthma. So if they have allergy and they have asthma, they will produce the leukotriene, and this leukotriene is really potent chemical or mediator that will constrict, the respiratory tract, the bronchus, trachea, bronchioles, and causing these people to have a very difficult breathing. So these are examples of the allergic mediators that produced by the mast cell after they encounter the allergens, maybe pollens, maybe animal hair, and any type of allergen that cause this person to have the allergic reaction. Example of type 2 hypersensitivity is the ABO blood groups when they receive blood from incompatible donor. Like for example, if the recipient is B type and the donor is A type blood, then this donor actually give the antigen A to the B recipient. And B recipient, they produce the antibody A that will attack this donor blood. And what happens when they attack, they make these agglutinations. So the blood become clumped, okay? It's clumping in the circulation of the recipient. So the recipient that will have problems with this transfusion, okay, because it's happening inside his body. So that's incompatibility with the blood transfusion. Another things for the type 2 is when the RH negative woman married with the RH positive man. So negative woman married with positive man, it will produce baby that is positive. It means that the baby actually carry the antigen rhesus. And the mother will produce the antibody that will attack the blood of the baby. And what happens? It will causing the baby blood to be destroyed. And usually, most of the time, the baby will die inside the mother womb. So this is incompatibility with rhesus blood. Okay, but nowadays, medicines, they usually mother with negative blood, they usually receive injections from the doctor if they have a baby. It is to protect the baby from the antibodies produced by the mother. So this is example of type 2 incompatibility or hypersensitivity. Examples of type 3 hypersensitivity. This is caused by the IgG. So this IgG, okay, this antibody will try to clog the antigens, and then they will deliver this antigen into certain tissue, and then it's blocking or killing the tissue on that area. It can be into the skin, for example, causing skin problem, maybe to the joint, to the heart, to the blood vessel, to the kidney, and many other organs. And then this IgG then will attack that organs, maybe to the pancreas, for example. When they attack the cell that produce insulin, and then that person will not be able to produce insulin. And usually this attack happening years. So they have a problem since they were born, but the removal or destruction of the pancreatic cell, the beta cell in the pancreas, taken time. Maybe after 7 years, 10 years, the kids will develop the type 1 diabetes. Sometimes when they are still baby, they will not show the type 1 diabetes because the pancreas cell is not destroyed yet. So after several years, then they will develop this type 1 diabetes. And if they already develop the type 1 diabetes, maybe at age 7 or 10 or 12, then they require to get the insulin injection for their life because their pancreas will not be able to produce any insulin because it has been destroyed by this IgG. So this is what we call the autoimmune disease. So there are so many autoimmune disease actually that happening in people. Like for example, glomerulonephritis. This is the IgG that will attack the kidney cell. Okay, so the kidney will get destroyed, and again, it's usually taken time. And these people usually need maybe kidney transplantations or dialysis and some other related medicines to the kidney disease. Graves' disease, this is causing the IgG actually attacking the thyroid gland, okay, causing that people to sensitive to the thyroid, so hyper secretions of thyroid hormones, okay, causing this overreactivity. Usually the symptom of this Graves' disease like restlessness, weight loss, irritability, increased heart rates, and blood pressure. I mentioned already the type 1 diabetes mellitus. This is caused by the IgG that destroy the beta cells of pancreas. And the symptom will be thirsty, hunger, weakness. Hemolytic anemia, the symptom is fatigue and weakness. This is attacking the red blood cell. Multiple sclerosis or MS, this is attacking the myelins on peripheral nerve. So this is related to nerve or nervous system. And the symptoms may be weakness in coordination in speech, disturbances, and some physical complaints. Myasthenia gravis, this is the one that attacking the muscle cell. Okay? So especially neurotransmitter on the skeletal muscle, and the symptom will be muscle weakness. So this is autoimmune disease. Pernicious anemia, the symptom will be fatigue. So anemia usually related to red blood cell, and that is not carry enough oxygens. Okay. So the problem is because the IgG attack the binding site for vitamin B in cell lining of our stomach. Rheumatic fever, okay, weakness, shortness of breath. This is usually attack the heart valve. Okay. And then rheumatoid arthritis. This is one of the common autoimmune disease, especially for older people. They attacking the joint tissue. So the joint tissue will be destroyed by IgG. Okay, so it's going to be joint pain and deformity. Systemic lupus. Okay, so this is also common. Lupus, which is type of autoimmune disease. This is mostly attacking the connective tissue. Some symptoms is red rash on face, prolonged fever, weakness, kidney damage, and joint pain. So this is sign and symptom of lupus. The last one over here is ulcerative colitis, which is attacking the colon cell. So problem will be in the digestive system. The symptom will be lower abdominal pain. So these are some examples of autoimmune disease that is caused by the IgG overreaction. So this is type 3 hypersensitivity. The last one, the type 4 hypersensitivity. This is caused by the T cell. The most common one is dermatitis, like poison ivy, that causing the T cell to attack our own skin cell and causing these inflammations on the skin. So this is dermatitis. Another example is when we receive the transplantations, maybe tissue transplantation like skin graft, or organ transplantations like maybe the heart transplantations. The T cell will try to reject that organs or tissue. There are several types of graft or transplantation. The first one is called the autograft. So auto means self. So autograft means the tissue or the organ is coming from its own body. So like for example, if someone have tissue or skin graft transplantations on their face, for example, the skin can be taken from other part of our body, maybe from their thigh, for example. And usually if it is coming from its own body, there will be no rejection because the T cell will recognize that graft is coming from its own body. So there is no rejection. The second type of graft is called the isograft. This is coming from the twins. This is identical twin. So usually it will no, there will be no rejection because the twin, actually identical twins, they have similar antigens. So if the skin coming from the identical twin or the organs coming from the identical twins, then mostly no rejection. The next one is called the allograft. This is the organs or the tissue coming from other people. Okay, so usually there will be rejection because the T cell will recognize this organ as coming from different people, carry different antigens. Okay, the last one is xenograft. This is transplantation organ from other organism, maybe from animal, okay, to human, and usually it will be rejected. There will be rejection. Okay, so in order to fight these rejections, usually doctor will give the anti-suppressant drugs that will try to fight this rejection by the T cell. Just for additional information in the HIV and AIDS immune system. So HIV, it is human immunodeficiency viruses. So from the name, it is telling us this virus actually will causing immunodeficiency to human. So loss of the immune system. And as I mentioned before, these HIV viruses actually attack the T helper. So it will stay in the T helper and using the T helper to produce more viruses. And then when the virus is produced from the T helper, it will attack another T helper until when it is reached, the T helper is destroyed less than 200 cells per microliter of blood, then that person will start to have the AIDS disease. So the AIDS is happening after the T helpers destroyed in a very low concentrations. Okay? So sometimes it takes 2 to 15 years to reach the AIDS disease from HIV positive infection. And usually the person with AIDS will die because of lost the immune response against any pathogen or cancer. Okay, sometimes these people will really get cancer easily. So AIDS people, they usually have skin cancer. They also maybe have pneumonia really easily. They might be die because of just a regular type of disease, okay, like pneumonia, some digestive system disease like diarrhea. It can kill them because they don't have the ability to fight against this type of infectious disease. Mode of transmissions of this HIV or AIDS is mostly sexual contacts, okay, contaminated needles, birth, so the baby might receive the HIV from their mother or maybe from milk, infected mother, and receiving blood transfusions or donor from the donor that have the HIV positive. Lifespan changes for the immune system, lymphatic system. The immune system function will decline early in life. So thymus gland usually will be reduced in adults compared to younger people, shrink over 25%. And when it is older, then this thymus gland will be replaced by the lipids or fat tissue. So basically, older people will have less ability to fight infection because the thymus gland is smaller, and because of that, the T cell will be lower in number. So the strength of the immune system response will be decreased for elderly people, higher risk of infection, cancer, and disease like pneumonia for older people. And T cell number will be decreased, and the B cell number also decreased, but mostly it's not really decreased like the T cell. So B cell kind of stay in older people. The antibody response to the antigens become slower. The IgG is actually increased. So this is really Remember, the B cell, they don't really decrease compared to the T cell, and B cell is the one that produces the IG, the antibodies. And this IgG is actually increasing in older people. So that's the reason why older people might have higher risk of getting autoimmune disease, because IgG is the one that causing the type 3 hypersensitivity. The IgM, IgE, they usually decrease in number. Vaccine might require extra dose for older people, and more auto antibodies may be produced, okay, causing the autoimmune disease. The elderly might not be a candidate for certain medical treatments like suppress immunity or chemotherapy. So sometimes older people, they will not receive the chemotherapy because their immune system is already weaker. So this chemotherapy can make their immune system even weaker. It's going to be dangerous for them. Okay, and that's all for this lymphatic system. I think we'll see you again for the next organ system. Goodbye now.